Roshnee, shall we start?
Yes, ma'am. Sure.
Okay. Good afternoon, all. I welcome you all for this menstrual health management and hygiene session. The onset of menstruation means a new phase and new vulnerabilities in the lives of adolescents. Yet many adolescent girls faces stigma, harassment, and social exclusion during menstruation. Menstrual health and hygiene interventions can help overcome these obstacles. Not only do they fulfill the unmet demand for menstrual hygiene products, they also get dignity, build confidence, and strengthen sexual and reproductive health, particularly among adolescents. I welcome Ms. Roshnee for this session to be the resource person. Ms. Roshnee Bhowmick is the CSR executive in Unicharm India. Working with Unicharm India since 2018, mainly responsibilities for all CSR activities in Kolkata. Campaigning for menstrual health and hygiene management in educational institutions and also in non-profit organizations and in the community level as well. Has conducted sessions on menstrual health in more than 90 plus institutions across Pan India. Graduated with psychology honors and completed masters in social work, worked in the area of child protection and health for more than 6 years. So I welcome Ms. Roshnee Bhowmick for this session, and over to you, Roshnee.
Thank you, ma'am, and thank you for the introduction. So good afternoon, everyone. Welcome to the session. Hope everybody is doing well. So before I begin, let me present my screen and few requests before I start. So this would be an interactive session. So I would be asking very few basic questions regarding your experience on the subject. So if you know, please do respond. Write it in the chat box because it would be easier for all of us to understand. And also it would be easier for me to proceed with the session. So when asked, please do respond. So is my screen visible to all? Ma'am, is my screen visible?
Yes, Roshnee. Yes, it is visible.
Okay, ma'am. So an introduction about Unicharm. Of course, ma'am have introduced that I am from Unicharm. So is the name Unicharm familiar? Have you ever come across this name earlier? As you can see, there is a name written Unicharm on the screen. Yes or no?
Girls, you can unmute yourself or you can put it on the chat box. Roshnee, is that okay if they could type it on the chat box?
Yes, absolutely fine, ma'am.
Yeah. So girls, you can, if you can unmute yourself and you can speak up, or else you can put it in the chat box.
A very easy question. It would be just a yes or no. No, ma'am. Okay. All right. So you might have come across products such as Mami Coco Pan diapers or Sophie sanitary napkin. So Unicharm is that company which manufactures these products. It also manufactures adult pan style diapers under the brand name of Life Free. It is a Japanese company which has started out in India in 2008 and since then has been manufacturing and selling these products in India. And I am from Unicharm CSR department wherein we organize sessions on menstrual health and hygiene management across various educational institutions. So another question to all of you, according to you, do you think as individuals we are all same or are we all different in nature? As individuals, are we all same or are we all different in nature? Yes, unique. Okay. That's another saying that we are all different. Yes, we are same but different. Yes. So, yes, of course, human being wise, we are all same, but individually looking, we are all different. Likes, dislikes, appearance wise, we are all different. So, given a similar situation to all of us, we all react to it differently. So, today the information I am going to share is based on general knowledge, experience, and data. But ultimately, the entire process will depend upon your and only your body type only. So, please do not compare yourselves with your friends, with your family members, especially your mothers or sisters, because their experience might not be similar to yours. The information I am going to share today, you might feel it is not applicable to you, and it wouldn't mean that there is any problem with you. Maybe as per your body type, that is normal for you. So, we will have a question answer round at the end of the presentation. So, if you have any questions, queries, doubts, then please feel free to ask. I will be happy to clarify all your doubts. So, why are we arranging this session? The reason for us talking about menstrual health and hygiene. So, first of all, period is still considered taboo. We don't talk about it openly, especially in front of the male members. But please remember, period is a very natural biological process. Just as we breathe, we get hungry, we feel thirsty. Having period means that our body functions normally. So, any girl on earth whose body functions normally will have periods. So, but unfortunately, there is a lot of myths and taboos related to it. So, we need to know the entire process behind it, the physiology behind it, so that those taboos and myths be broken and we can normalize the topic. Also, you need to know about how to maintain your hygiene because poor hygiene management can lead to very many menstrual abnormalities. And it is important that we have the right knowledge at the right time. So we also do conduct session with adolescent girls. So and it is also up to you to pass on these information to the younger ones because it is specially for them and it is important for them to know about it from beforehand so that they may stay prepared. And along with periods come very many different changes, be it physical, be it emotional, for both boys and girls. Of course, boys don't have periods, but they also do go through a lot of process when they grow up. So it is important that they should also know about it so that they are and they are a lot of and they are very much curious, especially during the adolescent stage. So it is important that the adolescents especially should know about this, and for the boys they could support the girls, and for the girls so that they are able to prepare themselves and manage themselves from before. So of course you all have started with your periods. Most of you do know about the process, but just a quick recapitulation about when it all starts. So we all grow up, right? From childhood, we grow on to become adults. So when a child proceeds towards adulthood, they enter the adolescent stage. So the adolescent stage is mainly the teenage years. It starts from around 10 years and goes till 19 years of age. So when a child enters the adolescent stage, they start with the process of puberty. Now, what is puberty? It is the process of physical change wherein the child's body matures into an adult one and one is capable of reproduction. So in other words, during this process of puberty, there are very many hormonal changes within the body which stimulates growth and development in different parts of the body. So it is only after the completion of the process of puberty that one is able to reproduce. Before that, one is not able to reproduce. So this process of puberty for us girls compared to boys begins bit early. It begins around the age of 8, 9 or 10 years onwards for girls. For boys, it is a bit late, that is around the age of 11 or 12 years onwards. It continues throughout the middle adolescence phase and gets completed around the age of 19 years or a little beyond that. So what are the physical changes am I talking about? So participants, can you tell me what are the physical changes that the adolescents do go through when they start with the process of puberty? Anyone?
Girls, you can use your chat box. Ma'am is asking, what are the physical changes you undergo when you attain puberty?
Very simple changes. We all have gone through that phase. This is just a quick recapitulation, a revision.
Yes.
The basic changes which one can see when a child is growing up or when an adolescent is growing up.
Yes, you can use your chat box if you are not able to unmute and speak. Yes.
Yes, I'm getting answers. Growth spurt. Yes, growth spurt, of course. Apart from growth spurt, anything else? What are the common changes or the specific changes that boys go through and the girls go through? Okay, so
Do you all feel shy to
yes.
share it?
Growth of facial hair for boys, very correct. Change in voice in boys. Yes, absolutely right. What about the girls? What are the changes that the girls go through? Okay, so just to continue. So thank you for answering. Yes, so you all know about it. Maybe you must have forgotten about those changes. So there are few changes which are common to both boys and girls. Those common changes being first is the height increases, weight increases, as mentioned by one of you, growth spurt is there. Apart from that, there is hair growth in the underarms as well as in the pubic area. There might be pimples or acne on the face. These are common for both boys and girls. Apart from these, there are few changes which are specific to boys. Those changes being their voice deepens, their shoulder broadens, growth of facial hair, and also their sexual organs develop. So the male hormone testosterone is responsible for the changes within the boys. Then there are changes that only the girls go through. Those changes being the breast size increases. Girls do start with their periods and the pelvic area or the hip area, it widens. And the female hormones, estrogen and progesterone, is responsible for the changes within the girls. So just as the adolescents do go through a lot of physical changes, they also go through a lot of behavioral changes as well. So these hormones also impacts their behavior. So how it changes? So if you remember yourselves in the early adolescent stage, so it is in that stage when most of the development, physical development just begins, and those developments inspires a lot of curiosity among them. And in terms of thinking, then they have a very concrete black and white thinking. If they like something, they like it a lot. If they don't like something, they hate it. There is not much room in between. And also, there is a gradual increased need for privacy, which gets increased in the middle adolescent stage. So, when we during the middle adolescent stage, especially, the children become very, very emotional and sensitive. So they can't accept denial very easily. They get instantly angry, instantly sad. So their emotions and their behavior is very instant in nature. Yes, they are pretty much short tempered, impulsive. They go through a lot of stress. There is a lot of peer pressure around them. So just in order to make themselves belong to a particular group, or in order to prove themselves, they do certain activities which maybe shouldn't be done, or when they see their peers performing well in academics or extracurricular activities, it might also motivate them to do the same. Mood swings are at its peak, especially in the middle adolescent stage, because the hormones affects their moods, and they're very much conscious about their appearance, about how they look. So they get very much they do spend a lot of time in front of the mirror. Also, they get into a lot of arguments with their parents. They would like to spend a lot more time with their friends than with their family members. Now, when the middle adolescent children enter the late adolescent phase, so most of them do come to terms with their own values. They are able to gauge the risks and rewards better, and also in terms of relationship, be it with their friends or family members, they have become much more stabilized. So these are the different changes in their behavior throughout the entire adolescence phase when they are hit with the process of puberty. So now we come on to the reproductive phase in a woman. So the very first time a girl experiences periods, it is known as menarche. The very first time a girl experiences bleeding from her vagina, it is known as menarche. Before menarche, will a girl be able to know that she is about to start with her periods? Well, of course, she wouldn't know the exact date or time, but she would definitely have an idea. So, around 3 to 12 months before menarche, they start with white discharge. So, what is white discharge? It is a secretion which is sticky, slimy, mucousy. It could be pale yellow, it could be whitish, it could be colorless, it could have a smell too. So, when a girl starts secreting white discharge, then anytime within the next 3 to 12 months, a girl can start with her periods. So, at what age do you think should a girl start with her menarche? Participants, can you tell me at what age should you think, according to you, should a girl start with her menarche? 12 to 13, okay, 10 to 13, all right. Okay. So yes, you are correct, but you need to increase that age range a bit more. Usually, any time between the age 8 to 15 years, a girl can start with her periods. So, any time within the age 8 to 15, a girl can start with her periods. So, on what factors does this age of menarche depend upon? So, it depends upon the genetic factors. When the female family members started with their periods, not only that, it also depends upon the girl's regular diet, the environment she is living in, her physical health as well as her mental health. Depending upon all these factors, will the age of menarche be determined. So now we come to what is menstruation. So participants, can you tell me according to you what is menstruation or what happens during our periods? Anyone? What happens during our menstruation or periods? Anyone would like to answer? Okay, the lining of your uterus starts getting thick and spongy again. Okay. Breaking of endometrium, yes, correct. All right. So, thank you for answering again. So, menstruation is basically the periodic discharge of blood and mucosal tissue from the vaginal opening. So, the most common answer when I ask this question is that it is the cleansing process of the body, or the dirty blood gets discharged out. But thankfully, I did not get this answer. So, it is the discharge of blood and mucosal tissue from the vaginal opening. So, many women also do not have the idea from where we bleed. So, for them, we clarify that the female genital area has three separate openings. First is urethra, from where we urinate. Second is vagina, from where the blood during our period is discharged out. And third is anus, from where we excrete. So, the opening from where we urinate is separate from the opening from where the blood during our period is discharged out. So the number of days a girl should usually bleed is for 3 to 7 days, minimum of 3, maximum of 7. And one menstrual cycle may last for 22 to 40 days. Now, these two would differ from woman to woman, but for a particular woman, it is generally fixed. So, for example, if a girl's menstrual cycle is of 30 days and she bleeds for 5 days, she would continue with that. Uh, she would continue with that process or with that number unless and until there is some major change within her body. So, from where is this blood coming out from? So, it is with the help of this reproductive system, or the process inside this reproductive system actually leads to a period. So, what are the different parts of the reproductive system? In the middle, we have the uterus, which is a muscular organ. The inner lining of the uterus is known as the inner uterine lining or the endometrium. So, one of you did mention breaking of endometrium. Yes, correct. The inner lining of the uterus is known as the endometrium. On both the sides of the uterus, there are ovaries. The ovaries contain eggs. It contains around 10 to 20 million eggs. Attached to the ovaries, there are the fallopian tubes. Function of the fallopian tube is to carry one matured egg from the ovary towards the uterus every alternate month. And below the uterus, we have the vaginal tract, which leads to an external vaginal opening in our genital area. So, what happens inside this reproductive system, which leads to our periods, could be understood by studying our menstrual cycle. So, this is our menstrual cycle, and it begins on the day one of our period. That is the day one, the first day of our period is considered as the day one of our menstrual cycle. So, suppose a girl bleeds for 5 to 6 days. After the fifth or sixth day, when the period stops, then immediately the inner lining of the uterus starts to prepare itself for the possibility of bearing a baby. So the inner lining starts to thicken, it becomes enriched in blood and nutrients. So layers of blood is being deposited onto the inner lining of the uterus. That is the endometrium layer, it starts to thicken. So while the endometrium lining is thickening, becoming enriched in blood and nutrients, why it is becoming enriched in blood and nutrients? Because that same lining provides protection and nutrition to the baby inside the womb. So while it is thickening, simultaneously around the 14th or 15th day, one egg inside the ovary gets matured, gets released, and through the fallopian tube starts to travel towards the uterus. While traveling, if the egg gets fertilized, then the fertilized egg will implant itself onto the same endometrium lining, thereby converting itself into a fetus and taking the shape of a baby in future. If the egg doesn't get fertilized, then depending upon your menstrual cycle, so be it on the 28th day, on the 30th day, or on the 40th day, when the body notices that the egg is not yet fertilized, then the hormones within the body will signal the uterus to shed the inner lining, that is the endometrium layer, along with the unfertilized egg out of the body. So the blood which is being discharged out during our period days is this unfertilized egg along with the endometrium layer. So why it is not dirty or impure in nature? Because that same layer, endometrium layer, provides protection and nutrition to the baby. Had it been impure or dirty, it wouldn't have been able to provide that function. Also, many of us think that there is a lot of blood loss during our period days, but again, it is not so. Only 2 to 3 tablespoons of blood is being discharged out along with other secretions such as endometrial fluids, microbes, white discharge, mucosal tissues. So, not more than 80 ml of blood, milliliters of blood is being discharged out during our period days. So just as we start with our period, the process which is known as menarche, there comes a time when our period stops permanently, and that process is known as menopause. Menopause can occur any time between the age 45 to 55 years. When a woman approaches menopause or goes through menopause, she suffers from irregular periods, mood swings, vaginal dryness, memory loss. She could gain weight, she could have hot flashes, and there are very many effects on the body. So it is suggested if a woman is not able to cope up with the effects of menopause, then doctor's consultation is required. Also, many women approaches menopause before the age of 45. So it is known as premature menopause, could be caused due to reduction in hormonal levels, could be enzyme deficiency, thyroid disorder, maybe due to chemotherapy or surgical removal of ovaries. And also at times, many women, even after the age of 55, continues to menstruate. Could be caused again due to thyroid disorder, high level of estrogen secretion, maybe due to obesity or genetic reason. So in either of the cases, doctor's consultation is required. So participants, it is important that you keep a track of your periods. Very, very important that you do so. So, what is the benefit of doing that? You will get to know the number of days you bleed and the length of your menstrual cycle. What is the benefit of doing that? So that you may stay prepared for your next menstruation. You can know if your periods are irregular or not. How do you calculate your menstrual cycle? You count from first day of your period in one particular month. So to the first day of your period in the immediate next month. If you count the number of days in between, it will usually come in between 22 to 40 days. Now, on an average, most girls have a menstrual cycle of 28 days, but again, it is not necessary that it has to be of 28 days. It can happen anytime in between 22 to 40 days. So, please do keep a track of your periods regularly. So, when should you consult with the doctor? So, if a girl starts her period before the age of 8 years or have not started her periods even by the age of 15 or 16, then it is not normal. Doctor's consultation is required. Also, if one's menstrual cycle is very irregular in nature, suppose bleeding for less than 3 days, more than 7 days, continuously bleeding for months, not having period for months at a stretch, then also not normal, doctor's consultation is required. Also, if one experiences very, very heavy clots or the bleeding is very, very heavy, so it is so heavy that one needs to change the pads every 15-20 minutes, or if the flow is so low that or is so less that one can wear a pad for the entire day and only 2 to 3 drops of blood is being discharged out, then again it is not normal. Also, if you have very painful periods, now the pain or cramps during our period, which is mild in nature, which is bearable, is kind of normal also. Why? Because it is caused due to the contractions of the uterus. When the uterus contracts, it presses against the nearby blood vessels, thereby cutting off oxygen supply to the muscle tissues. Hence, once experience that pain, and that pain is bearable, that pain is mild. But if a pain or if the cramp is so extreme in nature that one can't get out of the bed, can't do the basic chores, can't eat, can't sleep, and it is accompanied by nausea, loose stools, headache, and dizziness, maybe it is caused due to some other obstruction within the reproductive system which is causing that pain. So, doctor's consultation is required. If you have very heavy white discharge, now having white discharge is also very common, provided you have it for 2 to 3 days before and after your periods. But if you're continuously having white discharge uh, for the entire month and your the discharge is brownish or greenish or yellowish in color, it has a fishy smell to it, then again not normal, doctor's consultation is required. So, in order to get relief from the menstrual cramps, which is caused due to the contractions of the uterus, we suggest you can try these 3 asanas at home. Very easy to do. You can do it anytime you want. There is, you need not have prior yoga experience. You always wear comfortable clothes before doing it, and always do it on a mat. Never do it directly on the floor. So the first asana is Vajrasana. So it alters the blood flow, nervous impulses, it strengthens the pelvic muscles. It is also very helpful for your digestive system. Second is Shashankasana. It stretches the back, realigns the vertebrae, releases pressure from the surrounding nerves. It also it also reduces anger and cools the brain. And third asana is Marjariasana, where it improves the flexibility of spine, neck, shoulders, and tones the reproductive system. So you need to do these asanas regularly, thereby only you can feel a difference. So sanitary napkins are the most used product during our period days. If you have a heavy flow, please change your napkins every 2 to 3 hours. If you have a low flow, please change your napkins every 4 to 5 hours. Do not wear a pad for the entire day or for more than 6 hours because there could be bacterial growth on top of the pad, and when it comes in contact with your genital area, it causes infection. Please remember the menstrual blood itself doesn't contain germs, but when the pad, when the menstrual blood comes in contact with the pad, and when that pad comes in contact with air, water, or sweat, if it has bacterial infestation in it, it could cause bacterial growth on top of the pad. So please change your pads frequently. So just as we need to change the pads, it is very important how we dispose of the sanitary napkin. So it is important that you need to wrap it in a paper, throw it in the dustbin. Especially in public toilet, do not throw it out in the open, do not flush it down the toilet. Never ever unfold and throw it. Always wrap it in a waste paper and throw it in the dustbin. That is the best way possible of disposal. So you need to maintain your hygiene properly. So you need to use a soft and absorbent sanitary napkin because and you need to use a napkin which has a cotton cover on top of it because cotton cover napkins are much more absorbent in nature. Also, you need to take bath during your period days. It is very, very important. Keep yourselves clean, keep your genital area clean and dry. You just need to wash your genital area with plain water. You need not use any soap, detergent, or intimate wash because if you wash the genital area with soap, detergent, or intimate wash, it will wash away the good bacteria in our vagina, making the vaginal area more dry and more prone to infection. So just use plain water. Use clean and dry undergarments regularly. Change your undergarments regularly. Try to use cotton undergarments. Wash it and dry it directly under the sun. It is only under sunlight will all the germs get killed. Please wash your hands before and after changing the napkins. Please use an Indian style toilet when using a public toilet because compared to Western style, the point of contact is much less and it lowers the chances of spreading infection. And please store the napkins in a clean and dry area. Do not keep it in a damp area. So you need to maintain your maintain your lifestyle properly. So most of your adults, you have your own choices, but please remember, excessive smoking and drinking does have a negative impact on your menstrual health. It is a scientifically proven fact. If you're into excess smoking and drinking, it can lead to estrogen deficiency, leading to painful periods, irregular periods. One have a higher chances of delayed conception and infertility problem. One is more likely to deliver prematurely, and one can reach menopause at a very early age. So whatever you do, please do it responsibly. So you need to maintain a healthy lifestyle. Healthy lifestyle means you need to eat healthy. You need to have a balanced diet. So anything healthy and nutritious can be consumed during your period days. there is no restriction at all. There is no restriction as to you can't eat this or that. Anything which falls under the category of healthy and nutritious can be consumed. Any fruit, any vegetable, any milk product, provided you don't have a problem with it. At times during periods, many girls lose their appetite because the stomach acid level rises, and so in those days it is better to avoid tea, coffee, oily food, spicy food, processed food, and salty food. Apart from that, anything is good to go. Please do not skip your meals, have it in small quantity, but do have it frequently. Never ever skip your breakfast, drink lots and lots of water. And if you're into sports and exercise, you can continue to do so even in your period days, provided you don't have a problem with it. If your body permits it, you can continue to do so even in your period days. It will help regulate your menstrual cycle. So my presentation has come to an end. Now, if you have any questions, any doubts related to the topic, please feel free to ask.
Girls, do you have any questions? You can post it on the chat box also.
Any questions related to taboos, myths, abnormalities, please feel free to ask. Any hygiene tips?
I hope it was too elaborate and it has given enough information that they do not have any doubts.
Okay, ma'am. So I hope people got the presentation and they are able to maintain their hygiene properly. They are able to maintain their lifestyle.
Yeah. So thank you, Ms. Roshnee Bhowmick, for educating our students on the menstrual hygiene management. Um, it was very elaborate and it was very educative, and hope the students have understood well and how to manage their menstrual pain also. I think that asanas which you spoke, it was really very informative, because students sometimes what happens during their periods, menstrual time, they have pains. So normally they get into taking any kind of painkillers. So it is girls better to avoid painkillers and tablets taking during your menstrual time to avoid the pain. If you are able to bear the pain, it is okay. If you are unable to bear the pain, you can go in for other home remedies like
Yes.
methi seeds or something like that. And the asanas which Roshni spoke to you, I think that is also more effective, but without any um, um, guidance, I think it's not okay to do those asanas. With better guidance from better teachers, it would be more helpful for you and you can do it. So thank you, Ms. Roshni, for being with us. I thank you all on behalf of our management, principal, staff, and students for being with us and educating us on this topic. Thank you so
Thank
much.
you, ma'am. Thank you so much. Thank you to the college as well and to the participants for listening to me so patiently. And please do maintain your hygiene. And as ma'am said, of course, please do take care of your health in terms of having mild cramps or pains. If it is bearable, fine. If it is not bearable, please do consult with the doctor, because the cramps could be caused due to very many reasons. It could be caused due to many other abnormalities such as endometriosis or PCOD or fibroids. So please ensure that you know what causes that pain, then only go for any medicine as recommended by the doctor. Do not take any painkillers on your own. And please do maintain your health and hygiene properly. So thank you, ma'am. Ma'am, a request. So I can see the session has been recorded. If the recording can be shared with me, it would be great.
Yes, definitely, Ms. Roshni. We will be sharing the recording with you, and thank you for being with us. Thank you.
Thank you,
Have
ma'am.
a
Thank
nice
you
day.
so much. Thank you, ma'am. You too also have a good weekend. And the participants also, please do take care of yourself and have a great weekend ahead. Thank you.
Thank you. Bye.